Hello and welcome. Thank you so much for joining us tonight for our February Tourette talk, Cultivating Calm, Principles in the Treatment and Management of Anxiety, presented by Dr. Jill Richards. My name is Alina Osborne. I am the program coordinator for New Jersey Center for Tourette Syndrome, and I have Tourette's myself, actually. I'm here to facilitate the session and answer any questions about NJCTS programs and services that you may have. A couple of notes before we get started, and I'm going to share my screen for this. There we go. So a couple of notes. Everyone is muted at this time. You may unmute yourself if you would like during interactive parts, and including the questions and answers that will be at the end. If you are comfortable, you can also put your camera on during interactive parts of the program, as well as Q&A. We are being recorded right now, but the recording will end prior to the Q&A, so no personal information can be shared. This Tourette talk may be partly interactive, so those parts will not be posted to our Tourette talk archive when the video goes up. Lastly, there is a survey at the end of the program, and we really value your feedback. It really helps us inform future programming. And I will also share upcoming events at the end. Also, a disclaimer, please note that the New Jersey Center for Tourette Syndrome and Associated Disorders and its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented here today. We do not endorse any recommendation or opinion made by any member, presenter, or physician, nor do we advocate any treatment. You are responsible for your own medical decisions. The presenters are providing general information and not any therapy or health service. Thank you. And now I'm very excited to introduce Dr. Jill Richards. Dr. Jill Richards received her undergraduate degree from the University of Michigan and her doctoral degree from the Chicago School of Professional Psychology. She completed her, she completed her postdoctoral fellowship at Northwestern University while offering clinical services through comprehensive mental health services. Dr. Richards was formerly the director of Rutgers University Mental Health, Psychiatric, and Substance Abuse Services. Throughout the years, Dr. Richards has worked extensively with college students, and in addition, she has substantial experience working with adults, couples, and families. Incorporated into Dr. Richards' approach is a respect for cultural and individual difference and a deep appreciation of how power, access, and opportunity impact health and well-being. And without further ado, Dr. Richards, I turn the Tourette talk over to you. Thank you so much for presenting.
Absolutely. It's so delightful to be here with so many people who are interested in hearing about some of the principles that can be useful in helping with anxiety that we all get to experience as human beings. We're hardwired to experience anxiety. So we're going to talk about some dimensions of that tonight. I'm going to go ahead and share my screen now, and I've been speaking live more recently, so if I'm a little clumsy, forgive me, because I haven't been doing presentations on Zoom for a little while here. Okay, so this presentation is going to be slightly interactive, so I'm hoping that I'll be able to hear from you. Let's start with a bit about me and a bit about you. We'll talk about why we're going to be approaching this topic around anxiety. We'll explore some basic definitions, share some basic principles. There will be, as I mentioned, some experiential elements. And of course, we'll leave some time for discussion, ideas, questions, conversation. So let me start by telling you a little bit about me. So I am a clinical psychologist. For those of you who have used professional help or in the field or know about the field, what that means is that I have a doctoral degree in clinical psychology. I'm not a physician. I work hand in hand with physicians who are often psychiatrists or nurse practitioners in psychiatry to prescribe medicine. But my work is really in helping people master and understand and work with anxiety and spectrum anxiety concerns. There's a wide range of anxiety concerns that trouble people, and we'll talk a little bit about that. And I've gotten interested in this topic mainly because in recent decades, I was the director of the Student Mental Health Service at Rutgers University, and we saw a transition in time. We saw our culture shift, where for many years, the primary presenting concern in colleges and universities had been things like depression or mood concerns. And then around the year 2000, we saw a shift, and in university mental health, anxiety became the leading concern. And I do a lot of training of new psychologists as well as working in private practice. And so my work over the last more than a decade has been in understanding evidence-based treatments for anxiety. Now, while I can't do a comprehensive talk tonight, I'm hoping that my background in that area will shine through and you'll get some useful bits and pieces from the evidence-based literature. So I don't know if you're all muted or you can unmute. Are they free to unmute, Alina? I can't hear.
I'm actually muted. Yes, folks should be able to unmute themselves.
Yeah. So if anyone has a real special request for the presentation, or you want to tell me a little bit about your interest in why you joined us tonight, just a few. We've got a fairly big audience. So if just a couple of people want to share their interest in this topic, that would be great. If not, we'll move right on. Anyone interested in that? And how would I know? Would I see a hand raised? Or would Alina see that?
If somebody unmutes, then I should see a little icon and we should be able to hear their voice. If anyone is trying to talk and is unable to unmute, please send me a message in the chat and we will make sure to adjust those settings.
Very good. Okay. All right. So let's just take a moment and for the beginning of this talk, just get ourselves grounded a little bit. People have probably been running to and fro before they came and joined on the Zoom. So let's do a little bit of what we call grounding, right? Getting ourselves into the present moment and ready to talk. So we might just sort of take a moment, take a smooth breath in through your nose and out through your mouth. Maybe closing your eyes if you're comfortable doing so, or adopting a soft gaze in front of you if you're not, just to try to settle the body. We're going to be talking a lot about anxiety, so we may as well begin by regulating some of our own temperature, right? And bringing ourselves down to earth in order to have this conversation. So we breathe in smoothly and slowly, and out smoothly and slowly. Maybe noticing our feet on the floor, how it feels to be sitting in this moment. If you're seated with your back against a chair, you might just take a moment and notice that feeling of your back against the chair, your feet on the floor, and slowing down the heart rate with that slow breathing. Now we'll move forward. So why this topic is important, right? Because anxiety is the most common cluster of a psychiatric disorder as it's defined in the sort of scientific literature in our country. And the lifetime prevalence among adults having anxiety is nearly 30%, just under 30%. And social anxiety disorder is our most common anxiety difficulty. I want to be able to move you out of the way so that I can see this slide better. I'm having trouble with that. Hang on one moment. Slide you over a bit. Oh, it's not working so well. Okay, there we go. So social anxiety disorder is the most common, and we see a fairly early onset of that. So many people by the age of 11, in 50% of our cases will notice that. And by the age of 20, 80%. So the mean age of onset, you can see here is the mean age of onset for lots of different kinds of anxiety is shown here. Now, anxiety doesn't come in just one form, right? We have normative anxiety that we're all hardwired to experience, and then we have little clusters of symptoms that show up when we're under particular stress, and our bodies and brains may be hardwired to express certain kinds of symptoms. So you see there, we have separation kinds of worries and phobic worries, or any kind of anxious worry that might meet criteria to be kind of difficult and interfering with life, social concerns, OCD, agoraphobia, PTSD, panic, generalized anxiety. So lots of different types that start fairly early in life to express themselves in terms of the mean age. So the median age of onset overall, to have a cluster of symptoms that are pressing, right, stressing us and interfering with how we might function, the median age of onset is 11. So it's the earliest of all forms of difficulty that we sort of note in the medical literature. And 31.9, so nearly 32% of adolescents might suffer in this way. And 6% will have a severe difficulty. Girls are often more likely than boys, and anxiety in children and teens often overlaps with depression. So here you can see a slide that looks at, depression, anxiety, and sort of behavior difficulties by age, further illustrating why this is such an important topic for us to understand. Okay, and there we've got some lifetime prevalence of any anxiety disorder among adolescents. So the point here is that anxiety in all of its forms, when it becomes difficult and life interfering, can often start fairly early in life. So what's driving this, right? Why might we have so much of a struggle in a lifetime? It's complex, right? There's a lot of different reasons, a lot of different ways that anxiety is fueled. And certainly we've got, how our genetics and our prenatal experience, our temperament, how we develop, what's happening in society, family concerns, relationship concerns, changes with friends and peers, media and communication shifts, lots of things in our culture sort of press on us and impact the nature of how we experience anxiety, biological kinds of things, nutritional and disease elements, toxins in the environment, major life events, quality of treatment, all of these things. So it's a fairly complex picture as to why we might arrive at a particular cluster of symptoms. We also know, as many of you have seen this in your travels, that when we adopt a more fixed mindset, we're more likely to struggle with disabling types of anxiety, right? This is certainly not a causal variable, but it's an important one to consider. So if we're open to growth and we're thinking about challenge as something uncomfortable, but something we can face, and we persist in the face of things that are challenging and difficult, and we see this as an opportunity for mastery, and we're able to learn from criticism or difficulty and challenge and find inspiration in that way, we're a little less likely, we're a little less vulnerable to develop a cluster of symptoms that will be interfering with our lives. If we're more fixed, if we tend to give up easily or avoid challenges or see our efforts as fruitless, or we feel disabled in the face of challenge, and we ignore negative feedback or feel threatened by the success of other people. If we have more of a fixed mindset, we may be more vulnerable to anxiety. Okay, now treatment for anxiety disorders with something called cognitive behavior therapy, primarily with exposure elements in the therapy, range from 60 to 90% in terms of good outcomes. But sadly, we have tragically low utilization rates, and more people will seek out help for difficulties earlier in life, in adolescence, for things like attention deficit concerns than they will with anxiety. So sadly, we don't have as many people seeking, accessing, or maybe having access. We all know the healthcare system can be challenging. So there are problems with dissemination of treatments, accessibility of treatment, and treatment use. Okay, Okay, so one thing we want to keep in mind when we're thinking about anxiety is it's really not a monolith. When people say I have anxiety or I struggle with anxiety, that's only a sort of overview. It's like an aerial view. This is a picture of Disneyland from high above. And so really we have different sort of anxiety shows up in our bodies and brains in different ways, and different treatments emphasize are fit neatly with different kinds of anxiety. The thing that all treatments that really work when we're having trouble with more moderate to severe anxiety is that they address what we call the underlying nature of experiential avoidance, right? There's something that's driving us to avoid difficult elements of our internal experience, difficult elements in our lives. And so we need some level of support to pursue exposure, right? We've got to be able to move toward the anxiety in order to be able to live more peacefully and more effectively with it. And so we've got to have treatments that really target the duration and frequency and intensity of the anxiety, and really target the experiential avoidance that are common to all anxieties. But we also know that we need treatment that really fits neatly with that particular struggle a person is having. So one possible take-home message here is that if you suspect that you or someone you know and care about needs treatment for anxiety, we want to, my suggestion, certainly this is my own professional opinion, is that we want you to link up with somebody who has a background in evidence-based clinical care and understands primarily that all anxiety isn't equal, right? One is not exactly like the other. And if the person does a really thorough assessment, then you can really figure out what the best treatment is for the type of struggle that the person is having, and you're going to get much stronger, much better outcomes. If you have a kind of general approach to difficult problems with anxiety, you may get some gain. If you have sort of an open-ended talk therapy, you might benefit in some way, but you'd probably benefit a lot more if that treatment really targeted the particular kind of anxiety that a person is struggling with. Okay, any questions right away about any of this so far? Okay. So now we're going to talk a little bit about definitions, right? So what are we really talking about here when we say difficulty or challenge or struggle with anxiety? What's the difference between anxiety and fear? Does anyone want to venture a guess, or maybe maybe it's already very clear to you? How do we see that? What would be a primary difference between anxiety and fear? Any guesses, any ideas? Okay, so we'll take a look here. So fear is over here in the left-hand column of the slide, right? It's a basic hardwired response. It's what we kind of, we need it, right? A specific object or circumstance that we might be in signals danger, and we're hardwired to respond to it. It's a survival strategy, right? And when we're frightened, our sympathetic nervous system is activated so we can run, we can fight, or we can hide to kind of maximize our chances of survival. Whereas anxiety is often more prolonged. It's kind of a complex, sticky, difficult emotional state that happens when we kind of anticipate something in the future. It can often involve ideas about distressing things that we feel are uncertain or uncontrollable or unpredictable. And they might be imagined things that could happen in the future or maybe have happened in the past, but they're not immediately necessarily dangerous when we struggle with an anxiety concern that merits, help and support in order to move through it. They can be triggered by initial fears, but often that when we're struggling with an anxiety problem, it generally gets exaggerated and more prolonged, and it grips us, right? It keeps us in a state, our bodies are a little bit more aroused, and we feel like we don't have much control over what's going on often. And sometimes it can be driven by this kind of what if thinking. What if this happens? What if that happens? What if it doesn't go well? What if I think it'll turn out this way and it actually turns out that way? What if I don't know for sure? Those kinds of things can really heat up our anxiety. So here you see a slide about the sympathetic nervous system, right? We've got a friendly kind of traffic signal in our bodies that when it's working well is really great, right? We get a stress response. If somehow there's something really dangerous in our world, it's like the gas pedal on in the car, and our body heats up, right? It triggers energy in the body so we can protect ourselves and defend ourselves if there's a real emergency. And this leads to the, what you probably heard about, your fight, flight, or freeze response. Your heart beats faster, your tummy might hurt, your muscles might get tense, you might feel cold or clammy or sweaty hands, you might get racing thoughts, right? And then the brakes, right? This part of the system whose job it is to keep us more relaxed and balanced is the parasympathetic system. This helps our brain and our body to slow down and relax and save our energy. It helps us feel safe and comfortable, quiet and peaceful, and brings that heart rate and blood pressure down so our muscles can relax and our executive function in our brain can work effectively and we can solve problems. So all anxiety treatments are really targeting the flow of those two systems and being able to really have a kind of smoother flow between those systems. And many of you have probably heard about mindfulness. Mindfulness is often at the heart of many anxiety treatments because we have to be able to pay attention in a particular way in the present moment without judging our experience. We have to be able to stop in order to study what's going on so that we can understand our next steps when we have an anxious response. Okay, let me see if I can get this going, or maybe we're a little short on time. So I may come back to the struggle switch. This is a little quick video about how anxiety sometimes goes when we're having trouble. Let me see if I can
I've been looking for a product like this my whole life. I wear this product every day. We're all putting it on, looking in the mirror, and we're like, oh my God, this.
It often seems like we've got a struggle switch at the back of our mind. And as soon as an uncomfortable emotion, a painful feeling or memory shows up, it's like the struggle switch goes on and we start to struggle with it. So let's suppose anxiety shows up, a very common painful emotion that we all get to experience. Anxiety shows up, the struggle switch goes on. Oh, here's anxiety. I don't like anxiety. I want to get rid of my anxiety. Now I've got anxiety about my anxiety. So it's getting bigger. With the struggle switch on, I now get, oh, my anxiety is getting bigger. How do I get rid of my anxiety? Now I've got even more anxiety. With the struggle switch on, I may then get angry about my anxiety. Why is this anxiety keep showing up? I hate this anxiety. Then I might even start to feel sad about my anger. Oh, is this my life? Oh, and then I may start to feel guilty about my sadness, about my anger. Oh, how pathetic am I when there's starving kids in Africa? So with my struggle switch on, my emotions get amplified. I've now got guilt about my sadness, about my anger, about my anxiety, about my anxiety. And that kind of amplification of emotions gives them more impact and influence over my life and often gets me bogged down or pulls me into self-defeating behaviors. Now, what happens if I can switch off the struggle switch? With the struggle switch off, anxiety shows up, and it's not that I like it or want it or approve of it. It's just, I'm not going to struggle with it. I'm not going to invest my time, energy, and effort in struggling with this anxiety. Instead, I'm going to invest it in doing meaningful, life-enhancing activities, such as spending quality time with my friends and family or playing with my kids. Now, with the struggle switch off, the anxiety is free to move. It may get higher, it may get lower, it may move quickly, it may move slowly, but the point is it's free to move. It doesn't get amplified by all of these other emotions, which make it kind of bigger and stickier and make it hang around for a lot longer. So there's no such thing as a life without anxiety. It shows up for all of us. But when anxiety shows up and the struggle switch is off, it's so much easier to live with than when the struggle switch is on.
Okay. Sorry. Find my slides here again.
That was a great video. Thank you.
Oh, you're welcome. Yeah, so all these treatments are targeted at trying to help us allow the anxiety to rise and fall rather than trying to control the anxiety, because the more we struggle with our anxiety, the worse it gets. Now, that's easier said than done, right? You can't get rid of your fears, but you can learn to live with them. That's with a principle-based, evidence-based anxiety treatment, that's our goal, right? So a possible take-home message here is that learning about and modeling an understanding of the difference between fear, right, an actual threat, and management of worry is super important as we're growing up. As we're kids, as we're teens, as we're young adults, we need to be able to see people who can make that differentiation so that we can learn how to do that for ourselves. And if we haven't seen that, that's okay. We just need to learn it, right? And sometimes we learn that through a therapy, or sometimes we have other ways that we begin to learn, but that's really the ticket to being able to handle a lot of different forms of anxiety. Okay, now for some people who may be parents out there, I'm not sure how many of you are, I was hoping I might hear in the beginning if people had specific things they needed out of the talk, but people who may be parents or teachers or health professionals talking with kids and teens who are anxious, the first thing that we want to do, right, the main bedrock is to model and assist with what we call a stop skill. So being able to stop in order to notice what's happening when we're anxious is often the hardest first step, right? It's really, really hard. And I don't mean stop like when you're driving along in a car and you sort of see a stop sign and nobody's coming and you pause a little bit and then you keep going. I mean, really stop at the stop sign. So really drop anchor and be able to notice what's happening in our bodies, in our minds. So many therapies are aimed at helping us develop stop skills and model them for people around us. And we also, when we're trying to help somebody with anxiety, we want to validate the fear, right? Because it's very real for people. This isn't something people are making up, no matter where it comes from, and help them begin to acknowledge the difference between what they might be thinking and what might actually be happening. Because just because we think something doesn't mean it's true. And that's at the heart of many therapies for anxiety concerns. Okay, we want to help kids or other people, whoever it is that we might be working with or dealing with, who may have difficulty with anxiety, look at a range of outcomes, right? Because what happens when that nervous system is heated up and we can't really think clearly, we're going to foreclose a lot. We're not going to be able to think about a whole range of ideas and options. We'll need help thinking about what might be the worst outcome, what might be the best outcome, and thinking about what probably will happen. So sometimes when people are very anxious and they want reassurance, what's going to happen? How's this going to go? How can I be prepared? What if it goes horribly? Our best bet is to sort of say, well, what do you think will happen, right? What do you think the worst possible thing is that could happen? What do you think the best possible thing is? And what do you think will probably happen? Because regardless of what actually does happen, being able to have that skill of looking at a whole range of options is going to bring anxiety down in and of itself. And ultimately, we've got to deal with whatever the outcome is when it's happening, right? Not necessarily when we're thinking about it. So we can talk more about that if you're interested in it. Okay, so this is a bit about relational frame theory. This is part of this principled approach that underlies many evidence-based treatments for anxiety. It's kind of fancy language, but basically what this means is that sometimes when we're thinking, we don't think necessarily about actual relationships between things that are happening in life or things that are happening to us. We think in symbolic ways, right? For example, a coin like a dime, we know is larger in value, even though a nickel is physically bigger than a coin, right? Than a dime. So what happens in our minds is sometimes we get very kind of twisted turns in how we're thinking about symbols in our life, right? So for example, let's imagine that a person and a dog have a traumatic experience in a supermarket and they both get bitten by a snake in a soup aisle. Now the dog might avoid things that are physically similar to that event, right? Like snakes, supermarkets, and soup aisles. But only a person will fear and avoid things that are like those objects, right? Like the word snake written in a book might be a little scary to somebody who was bitten by a snake. Or a Campbell's soup commercial might be very scary if that happened in a soup aisle. Or making a grocery list might remind that person of that soup aisle where the snake bit them. I know Alina is not liking this because she loves snakes. This is not really true to form. Many things can bite, not only snakes, right? They might read about trauma and think about the time they were bitten by the snake in the soup aisle and get scared of that, right? So the dog has a much luckier break. Some mammals have a much luckier break than we do. We have all this symbolic stuff going on in our brains, and it can really trip us up and lead us to tangles of anxiety, right? So we would try to escape those symbols. We would try to get away from those reminders, but the dog wouldn't, right? And so treatments for anxiety that are really helpful draw on how these learned patterns of thoughts and feelings and sensations influence our experience and whether they limit or expand our movement toward things that really matter in our lives. That's our carrot. That's what we have to go for all the time, is stuff that really matters to us. So let's do a little bit with this, right? Some of these frame theory concepts are really, really helpful. So for a moment, I'd like you to close your eyes. And I'd like you, whatever you do, no matter what, do not think about elephants. And if you think about elephants, then please suppress it by all means. Don't allow those thoughts of elephants to come into your mind. And what's happening? Anybody out there in the Zoom world going to tell me what's happening?
I'm thinking about a lot of elephants.
You got it. So thought suppression is not helpful. So when somebody says to an anxious person, oh, just don't think about it, forget it, it's not worth your time, it doesn't really work, right? So a therapy that's really going to help with anxiety, or a strategy that one might adopt on their own to help with anxiety, is not going to involve thought suppression. What's it going to involve? It's going to involve exposure to the idea of the feared snake or the feared elephant, because we know that we can think anything in our minds, right? And while our bodies may respond symbolically to that thought, we can learn to ride out that anxiety, let it rise and fall all on its own. And that's the juice. That really helps us beat anxiety. Now, the other thing we can do is we can realize from our philosopher friends here that developed relational frame theory, is that we also live in a lot of word prisons that tangle us up in anxiety, right? So, or other difficulties, like on this slide, we might think, I want to go to the party, but I'm too depressed, I can't do it, right? And if we just shift our language a little, I do want to go to the party and I'm too depressed, we may be able to have the thought of being too depressed in our minds and still walk our feet out the door to the party. And then we want to see, if we're in the party having the thought about feeling too depressed to be there, are we as depressed as we were before we went? Or does something shift, right? So we need therapy to address these word prisons, and we need therapy to be able to help us digest things rather than turn away from them. Okay, so if you close your eyes again, and I want you to do another little experiment and say this word milk over and over, milk, 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 in your mind. What happens? Anybody out there? What happens to the word? It gets kind of garbled. It starts to make no sense at all, right? It's like just a garbled set of words, right? So we can play with words in our minds, and it shifts the meaning, right? It shifts the meaning of it. So we can expose ourselves to difficult ideas or fearful ideas, and we can play with them in ways that actually decrease our anxiety. So that's called cognitive diffusion. And sometimes we need to do that with picturing certain kinds of things in funny ways, or thinking about them in our minds in kind of interesting and different ways, in order to allow them to be there, so that we aren't pushing them away with thought suppression and creating more anxiety, like the trouble switch said, right? That's called cognitive diffusion. There's a lot of different ways to work with cognitive diffusion. That's just one way. Okay, so in evidence-based treatments, this is kind of a weird looking slide, but we often have these 6 principles that we've been talking about here that are active, right? When people have trouble with anxiety, we want to help ourselves and people who are struggling get contact with the present moment and be able to stop. That's principle 1, so that we can really figure out what's going on here anyway. Then we want to go down there to the bottom point, and we want to sort of view ourselves in this context and use some of the strategies that I just talked to you about in terms of perspective taking and cognitive diffusion there on the left. And then we've got 3 other principles that really help. Those are on the other part, the other little spokes of the psychological flexibility pyramid here. So we've got acceptance and values and committed action. So we're going to talk all these things together are principles that underlie really effective anxiety treatments and help us be more flexible and adopt that growth mindset that we were talking about earlier. So we want possible take-home messages for people who are trying to help those who may be anxious and on the younger side, or if we're thinking about formative experiences when we're young, is we want to pay attention to the language that people are using when they're anxious. We want to focus on whether the language is really fused and try to gently indicate there might be alternative ways to think about things rather than saying, don't think about it. We want to say, well, you can think about it. That's one possibility. There may be other possibilities as well. Let's try to expand the frame, right? So we want to notice that those stories our minds tell us are not necessarily true and important. And we also want to let them be there and expand on them in order to help ourselves with anxiety. Okay, so what is that? At the heart of this is experiential avoidance, right? This is at the heart of most anxiety, right? So we're trying to get away from our experience, what's happening with our senses, our feelings, our thoughts. And we do it in a lot of ways. There's overt ways. We might run away and avoid certain things because we're too frightened. We may also do things in our minds. We might do rituals in our minds to suppress anxiety. We might ruminate, right, to avoid feelings of sadness or fear. We might fight with a spouse or another person in our lives if we're avoiding feeling vulnerable. With anxiety, mostly what we're avoiding are our thoughts and our sensations, right, of the anxiety itself. That's often at the heart of what gives us trouble. So control is the problem, right? So if you're dealing with somebody who's struggling with anxiety, you might do a simple assessment. You might say to them, what have you tried? How are you trying to control this monster called anxiety? How is that working for you? How might it work in the short run or the long run? What is it costing you to try to control it so deeply? Are we going to keep digging this hole? Or are we going to kind of slowly climb up a ladder and try to get closer to something that may seem scary and dangerous, but maybe we can handle if we do it a little at a time? The quicksand metaphor is often helpful. Does anybody know that one? What do you have to do to get out of quicksand? If you fall.
Oh, is that the more you struggle, the worse it gets?
Exactly. If we
And,
allow our
If I
body.
could interrupt for just one moment, it's 7:45. So if we could allow some time for questions and answers soon, that would be awesome. I don't want to cut off your presentation though.
No problem. 5 more minutes, right?
All right, perfect. Thank you.
So if we allow our bodies to float in quicksand, then we rise to the top. But if we struggle, we go deeper, right? That's often the case with anxiety too. Or if we're in a tug of war with a monster called anxiety, we want to learn how to drop the rope so that maybe the monster just falls down. If we pull harder, it keeps the anxiety going, right? Okay. So this is all about what we call acceptance or expansion, really being willing to try to understand what the anxiety is about, and opening up to it in gradual ways, using cognitive diffusion like we talked about. And there's lots of cognitive diffusion exercises that I could share with you. I can send you resources if people are interested. These exercises that help us entertain thoughts and sensations in our bodies that we're frightened of a little at a time, and help us work with them rather than avoid them. Okay, values are very important in working with anxiety, right? Because the more that we've identified what matters to us most in life, the more willing we are to approach something that may be a little bit scary if getting through it gets us closer to something that matters, right? This is all about it, moving toward the things that matter most. So we've got, with anxiety work, we've got to identify and clarify what's most important to us in life. And we might break our movement toward it down into very small steps, or we might make a bold move and really move through parts of anxiety more quickly. We've got to notice our sensations in our bodies, our thoughts and feelings that might interfere with getting movement in that valued direction. And we've got to notice what we're doing instead of moving in a sort of non-judgmental, open way, really seeing where are the moves that we're making stuck. Right? And we want to get closer and closer to what we value most as we move through the anxious times. Okay, so we want to consider those carrots rather than a stick. We want to have something yummy that we're going toward, and we want to think about, how is anxiety interfering with that, and how can we help ourselves or other people move in that stepwise fashion. And in order to do that, we need the next little bit of that diamond I was showing you. We need committed action. We need to work gradually. We need hierarchies. We need ladders. We can't make changes all at once, right? It's very rare that as human beings. But if we make a small change, often our course changes quite dramatically. So we need to identify those small steps and go in hierarchical fashion. Okay, so here's how we do it, right? We make contact with that present moment. We use mindfulness principles. We're clear on what matters and why anxiety is getting in the way. We're taking committed action step by step. We recognize that the sense of who we are in one situation, right, in one space and time, may not necessarily match up to another one. So we're working with those symbolic elements of our thinking, like we talked about with the dog in the supermarket. We're working with cognitive diffusion. We're trying to look at our thoughts rather than live them out. We're trying to get a little perspective on them so that we can make moves in the direction where we want to go. And we're trying to expand options and expand experience rather than suppress it or control it or get rid of it. And when we do therapy or activities in life or learning in life, or have models who do these principles, we develop psychological flexibility, and that really helps us manage our anxiety effectively. Okay, and this is just a bunch of resources that I don't need to share with you right now. So that is perfect timing. So we are ready for any kinds of questions or discussion items about any of this.
Perfect. And with the question and answers starting, I will end the recording.